Good afternoon, Facebook, and welcome. I'm Shannon Cake in the WPTV News Channel 5 studios, and I'm welcoming in infectious disease specialist Dr. Gopalan Ramprasad as we tackle news about the Omicron variant and its potential impact on Florida. We appreciate you jumping on with us this afternoon, Doctor. We know you're quite busy. Haven't seen you, I think, since the first wave, and we had a roundtable discussion with you and critical care docs and some pulmonologists in town. So I'm sorry we're seeing each other again on this occasion. But it's nice to see you, and we appreciate your time nonetheless. We do welcome in our viewers to jump on and ask questions as we move through this next half hour or so, and we come to air here. Certainly, as we now know, as news just broke within the last half hour or so, that the United States has in fact reported its first confirmed case of the Omicron variant. This out of California, an individual in San Francisco who had been to South Africa tested positive for the Omicron variant. So we're going to unpack that. Certainly, we're talking about potential impact on Florida. No cases reported in Florida. We want to be very, very clear. But we've seen how this transmits to other parts of the country, unfortunately, several times. And so we want to talk about that with you, Doctor, in just a couple of minutes. But first, let's hear from Dr. Anthony Fauci addressing this first reported case out of the White House today.
As some of you may have heard, the California and San Francisco Departments of Public Health and the CDC have confirmed that a recent case of COVID-19 among an individual in California was caused by the Omicron variant. Genomic sequencing was conducted at the University of California at San Francisco, and the sequence was confirmed at the CDC as being consistent with the Omicron variant. So I know there are a lot of questions, but here's what we know right now. The individual was a traveler who returned from South Africa on November the 22nd and tested positive on November the 29th. The individual is self-quarantining, and all close contacts have been contacted, and all close contacts thus far have tested negative. The individual was fully vaccinated and experienced mild symptoms, which are improving at this point. So this is the first confirmed case of COVID-19 caused by the Omicron variant detected in the United States.
So again, you just heard from Dr. Anthony Fauci from the White House speaking about that first case of the Omicron variant now reported here in the United States. Doctor, we've been talking for a couple of days. I want to be fair and say, I don't think we say if. It's probably very likely based on, what we've seen in the past with Delta. I think the first case of Delta, the Delta variant was reported. I remember the phone call. It was New Year's Eve. My phone went off. And the first case, the Delta for South Florida, came in on New Year's Eve on the Treasure Coast, no less, in a man who had not traveled abroad. And so is it fair to say it's likely a matter of time before we see Omicron here?
Yes. What it is, it's just not confined to one geographic location. Now, since November 9th, I think was the first time they detected the variant in South Africa, Botswana area. But it is seen in Hong Kong, it's seen in Canada. So we have many more travel itineraries coming in this way. So this is the first known case. So I'm sure, we do have amongst us, people with this variant. But, it's just not where it is, what it is. It's a matter of time. We will have it. We will have the spread. But how are we going to deal with it? As we ask the questions down the lane, that's what is more important.
Absolutely. And so remembering back on when that first case of Delta was reported in South Florida on New Year's Eve, the newsroom was calling me, asking us to start calling our contacts and resources and asking questions about, has this really been around maybe for longer? Why out of nowhere in a man who's rather healthy, 38 years old, if memory serves, does Delta just pop up on the Treasure Coast, no less, a much less populated area of South Florida than certainly Broward and Palm Beach counties? How does that happen? And I think so many people have questions like that, Doctor. And I remember talking to an epidemiologist that night. They basically said they have to be looking for that genomic sequence in the lab. And if they're not told to do that, instructed to do that, very likely it was here for a while. And to your point that perhaps,
Right. the good thing about, not there's not much good thing, but the one good thing about the test is it's detected by the normal PCR. And one of the region what we look for, like in the three regions, one of the region is missing, Scott. So it doesn't require much of that's kind of gives it away that it is possibly the Omicron variant. So when you're doing the normal test, what has been proposed is if that particular region, we look for specific regions on the PCR, and one of the regions is missing, then it is possible that this maybe this. Then we can do genomic sequencing and go further. So this way, we know that variant is here. It's like a technically a less sophisticated test to target those people or individuals missing that particular link on a regular PCR test to target and do tests forward. I mean, nobody's talking about it, but that's is in the communications which is coming out of South Africa.
So let's be realistic. We've lived with this for 2 years. We've gotten pretty good at it for the most part. There's a lot of dissension in our communities. I think that's fair to say as well, in terms of,
Just getting ready.
Right. Okay. So let's be fair. And so let's talk about what we know. We know a couple of things. What would you recommend to people in terms of moving through this next variant? What is your advice right now?
This is the very good advice. Now you look at what came out of the person who was diagnosed with Omicron variant. It says, people may ask, he was immunized and still, he got it. Look what happened. He's home. He's not in the hospital. He's not on the ventilator. So even though you got infected, just like Delta, people did get infected, but their, clinical symptoms were very, very mild. People who are not immunized, their symptoms were horrendous in that variant. We don't know everything about this virus yet, this variant yet, but I'm hoping that that is true for this, although it has acquired many more mutations. What we usually predict when we do this kind of virology studies, we may create these kind of variants in the lab, and then we see what can happen when we do this. But it's only in the lab, doesn't go. This one has much more than what the worst lab scenario was. But so far, if this person who came in is any indication immunized, vaccinated, mild symptoms, please, I urge you all to go vaccinated. Get vaccination. This is one country where things are, you don't have to stand in line. It is given to you in drugstores. That's not the case in many parts of the world. So, heed to the warning where the person who got this variant still fine with mild symptoms.
So he's fine with mild symptoms. My understanding on the information coming out of South Africa is that most people who contracted Omicron, the symptoms were not as severe. And is that true? Is that what you have heard? Number one.
Don't know that.
We have a question coming in. Okay, clarify that, please.
Okay. See, this is very early in the phase of the virology. It just began a few weeks ago. But what we do know is there is one part of South Africa, the case rate went up by 400% in that small region, and they all knew it was Omicron variant. So, is it that we were looking and that became a dominant, species over there? We don't know that. So, the symptoms which are milder, in next 2 weeks, we will really know about it. We will know what's going on. We will know things about how it affects us and our life in general. If it is mild, the vaccinated people do get, but they get very, very mild illness. I think rapid vaccination of the unvaccinated population is the thing to do.
So it's not it's any less virulent in terms of the information you have received. And I understand we have to wait several weeks to kind of see, just as the other waves, kind of how it plays out. In your opinion, based on your knowledge and you've been on the front lines since the very beginning and haven't left. And thank you for that sacrifice on you and your family. So from your understanding, we don't know whether or not at this point it's any less virulent, but the fact that the number of vaccinated has improved or increased, that's helpful, is it not?
Correct. The question to that is how we look at things. Like we create these in the lab, we do create certain variants to see what will be the impact of certain things.
Mhm.
So the number was the lab created version was like 20 different alteration of the spike protein where that variant was really bad. This one, I think, almost has 35 plus. The nature it acquired a lot more than what the lab ever could create. But now, what does it translate to in terms of, it, causing the severe disease? Well, that's too early to say yet. But what we do know is people who are vaccinated so far, like as we just heard, have a very, very mild form of the disease. So now what we know is this that vaccinated, your chance and symptoms are pretty mild when compared to what? We don't know that part. If you're not vaccinated, would you be really worse? Probability is it might be, but we don't know that fact. But do you want to wait and see that, wait, I'm going to wait and see what happens to me when you're not vaccinated? Or you take vaccination and say, well, so far we do know the fact that it's been mild so far. I mean, risk benefit analysis between side effects and the benefits the vaccine is giving, I think far, outweighs in terms of getting vaccinated. So now, what we know in South Africa is yes, there is a region where the rate went up pretty significantly, like number of people got infected, and it is everywhere. It's in Hong Kong, it's in European Union, it's in Canada. There is no way you can lull into thinking we don't have it, and yet yes, we have it. First case diagnosed. So in the days to come, we will have many more. I mean, that's for sure. That's the
Mhm.
way the virus propagates. So, well, in terms of severity, the definitive answer is still yet to come. But anecdotal things, what we have seen so far, if you are immunized and protected, even though you may get infected, your symptoms have been mild so far. But
One question came in from one of our viewers, Julie Kana asked, so are you saying this is not as acute in a rather healthy person? Is that what you're saying, Doc?
no, I'm not saying that. What I'm trying to say is if you're immunized and see, this disease is so dichotomous. To definitely answer that question, I've had in Delta variant people who are triathlon people have no, uh, issues, many medical issues for to say, succumb to the disease at the peak of their health. So now, is this something like that? Or the probability, if you're a healthy person, you're immunized, and you have good immunity to that, you may fare well. That's a hypothesis, what we can say. But to be certain, it's yet to come.
Julie Hines writing in asking, can you mention or talk about natural immunity? This is a hot button topic, Doc, your position
Right.
on natural immunity.
Body, God has created great body, but we do have innate immunity in us to ward off certain things. That's how we're designed. That's why we're not sick every day. Although billions of things are floating around us, we don't. But the problem with the innate immunity is, this one, we don't know, but this infectivity of this virus is so that if you just depend on your natural immunity, well, you may be worse off because you really need a immunity enhanced by a vaccine to protect you against this virus. It may globally benefit you from having a good natural immunity, but so far all those young, healthy individuals who succumbed, who fell sick in the last wave, had great immunity. They were not, with any comorbidity. So I, would lull into, no false security here, but I think, yes, although immunity provided by nature for us is great, but I think having a vaccine and provided immunity in that way is possibly the best way to go.
Dr. Ramprasad, let me back up on something you just said. You said in the last wave, so that was Delta, that was, you're talking end of August, early September, correct?
Correct.
You said that you had a number of patients who were rather healthy, who had good immunity. Is that what you just said? I want to
Correct.
clarify.
No, I mean, you had people who are athletes, and there are stuff from European Union where there was one case. This guy was a triathlon athlete with a picture
Mhm.
of perfect health with the body, bodybuilder. He succumbed to the. I've been anecdotally speaking, and also from my own personal experience, I've had a lot of patients who are in the age group of, 20s to 50s
Okay.
and 20s to 50s whom we treated, and then they were having severe disease, and they were thinking, well, I'm young and this does not bother me. Even if I get it, probably it'll be like a cold. Well, yeah, for majority, it may be that, but the people who came to the hospital with this kind of disease, we cannot still predict why those certain individuals got to the point where they got. So if I take a whole slew of healthy individuals and there is a subset of them came into the hospital severely sick, now you can add something ticked off on them saying, oh, they had this, hence they were sick, so we can single them out. But there is no such thing we find or found yet. So with that, only thing that is shown to protect you from having a severe disease so far is vaccination.
And so, to clarify, your most severe cases or deaths were the majority
Unvaccinated,
were unvaccinated.
unvaccinated, and the age group in the Delta wave was pretty young. Because at that point, the older population were immunized from the first wave. And they were majority of the older population in the nursing homes, and all of them were immunized. The younger population was yet to get immunized. So that's the problem. And then majority of the patients we saw were in the younger generation.
So let me ask you this. Say I'm a double vaccinated person. I'm considering getting the booster before the Christmas, New Year, holiday, Kwanzaa window. We're already in Hanukkah, of course, so people are gathering in groups already through the holiday season. But I'm looking toward the end of the year here and into the new year, thinking I might be with groups of folks and I'm double vaccinated and considering getting the booster. Okay, that scenario. And now this new variant comes out. And we know we didn't know about the Omicron variant when the vaccine was developed. So, should I go ahead and get the booster when we didn't know about the genomic sequencing quite yet for Omicron? What is your
Absolutely.
recommendation?
Absolutely. You need to get the booster at least 14 days before you can do any of those mingling, traveling, and all. So now, why it is important? Because as we said, after 6 months, if your immunity is waning, the booster will boost that immunity to a higher level. Again, that's the premise of the booster. Now, we have seen vaccinated people are getting milder disease. So
Mhm.
now, with the vaccinated people getting milder disease and you being boosted to have an optimal level of immunity, what you can have, you will be better off getting the booster and have immunity at the optimal level at this point. So you have to get it like now for the holidays because you can't get a booster shot and next day go and mingle. So I think it's a good time is now to get the booster, and if you're not immunized, get immunized.
So it's your belief as an infectious disease doctor, and I'm looking at many of the comments in our comments section. So let's be clear. You are a local infectious disease doctor in South Florida. You round at multiple hospitals. You have been going in the darkest of times through this pandemic, caring for patients. You have seen more than your fair share, probably uh, more death in the last 2 years than you probably have in your entire career. I can say that because my husband's in a similar field, and that's certainly I know to be true in terms of what he has seen. Um, so your feeling is that the current vaccines and the current booster will hold up against Omicron. That's what a lot of people are questioning right now. And it is your feeling that is what you're saying?
Well, that answer to definitively answer the question, the answer we don't know. But the communication by vaccine makers, it may have a less efficacy than the before. But what it is translating to in reality, like how the patients are feeling, we got to take it how are the vaccinated patients faring clinically? That's what the question is about. And how are the unvaccinated patients faring in this scenario? Whether you got a 95% efficacy versus the first variant versus Delta versus all those are matter of numbers. But will it have less efficacy against uh, Omicron? Well, only time will tell. But what has been shown clinically at this point, these patients have less and mild symptoms. So now that's the major thing, and that's actually a shining light there, if I have to call it. But we still have to see the data. So do you want to wait for a specific vaccine if they make one for the Omicron variant? But wait, if it progresses through your community, as Delta did, now you're not offering the same level of immunity what was offered to by the patients who have been boosted, have 6 months out into Moderna and Pfizer, and 2 months out on Johnson and Johnson. So if you're any of those patients, then you don't want to wait, because yeah, it may have less efficacy, but it's still highly efficacious than not having that.
Continuing to look at the comments in the comment section, Doctor, can I just ask you a point blank question? And that
Sure.
is this. In the last 18 months, please tell me what your walk has been like.
Well,
What has your day, morning to night, from the moment you wake up until the time you go to bed, been like?
in the first wave, second wave, and Delta, in the well, we wake up in the morning and we go to multiple hospitals. So first we, go through the motions of, we still have normal patients, so we go see the normal patients, and then I go, take PPE, enter the isolated areas where we have COVID-19 patients, so see them come back. And in fact, I do have I mean, people may think it is too much, but I have a separate car where the kids don't travel. I have everything geared towards that. People make fun. I wear 3 masks, 2 masks, but hey, that's how it's worked for me. But again, you still need to have yourself protected, have yourself cognizant of what you're touching, have yourself cognizant of where you are and how you are interacting with people. This has been going on, and with Delta, when that wave hit, and it really took a toll on a lot of them, and I never could say I was, mentally fatigued, but there was no way we could do anything. It was like we working day in, day out. That wave really got to us. All the healthcare workers, without doubt, were really burnt out. Then most of them you hear saying in the circles, I can't take one more of this. But now, just in the last 2 weeks, it was great. We didn't have many cases. I think for me personally, I didn't have any new ones in the week or two, actually week or 10 days. Well, again, back to, we started seeing patients, whether it is, the variant or it is just the community one. Now the feeling is, here we go again, and this one is at the door. And I hope it doesn't have such an impact like the one Delta did, but only time will tell. But the issues are, we are becoming complacent now. You see nowhere, we're not using any uh,
Go right
masks.
ahead. My
And even
apologies.
though, yeah, like masks in community places. Like first when it came in, we all were very diligent. Now people are like, it's just there. But what we predicted, this will be like an endemic situation, where like a flu, where it can be contained. But with this new variant, hopefully this will be a mild situation. It's better to be highly extra cautious than let your guard down and then say, oops. So maybe we are in that situation where we do everything and then find out later on, hey, thank God it was not as worse as it was. It could have been. Then we're saying, well, we'll wait and see what it's going to be. Then only to see, oh, this is a tsunami and my door not going to hold it. So I think it's better off move to a higher ground now, and then you see there's just a puddle instead of a tsunami coming down.
And just to button that line of questioning up, I read a statistic, I believe it was in the New England Journal of Medicine just recently. I know for pulmonologists, about 98% of pulmonologists in this country are over the age of 55, and every single one of them polled wants to retire immediately, if not sooner. So let that kind of wash over you. In this country, we don't want to get sick and we don't want to get old, because that's not a pretty picture in our healthcare landscape. Let me ask you this very question as we begin to wind down, and I'm going to scan the comments section very quickly. So in your opinion, advice for folks as they move into the holiday season, should we be traveling internationally? What are your thoughts on international travel right now? Let me just whip out a couple quick questions to you. Your thoughts on international travel?
Well, so far we had, if you were vaccinated, if fully vaccinated, and the world was opening up. Well, it's everywhere. Whether travel from not, you cannot just single out one country versus other. Now, we still have to use the same precautions and same, personal hygiene guideline what we have been following. But if there is a hot spot where, you know, the cases are really bad and then you can't control, or the healthcare, if you're going from here to a place where if you fall sick and you cannot afford the same level of healthcare what you can afford here, then you really have to think about it. Or if you're going to a place where if you fall sick and you are able to take care, first of all, the guide is not to fall sick, but you can only do everything. You can get your vaccine booster, and don't travel to the areas where the incidence is very high or control, it's getting control. So, even for South Africa, we say, hey, there is a lot more cases, but we have to give them kudos because they do a lot more genetics, surveillance, and they were the ones who alarmed the world. Hey, wait a minute, there is something like this is here. And so we have to, applaud them for doing that study and then alerting the world that hey, you all have to be cautious. And I think that's a good thing. So for travel, be cautious. And the world was just opening up, and I'm even including me, and have I traveled for a personal family medical emergency? I did travel overseas, and I came back myself. And yes, with we're gonna see in a week or two what this variant is gonna do, in the world, and
Okay.
then probably we can plan if it is really worse, bad, like what Delta did. Then maybe we can take precautions, and then we have to assess the risk benefit. And I won't take it off the table yet, but before you do, please be vaccine immunized fully and with booster if you qualify for that booster. And you know I think we got to deal with this, and then hopefully we will learn to live with this. And also there is a talk about vaccine, you know like economics of the world. So we have to immunize the whole world. We have to make sure. Why? Because guess what, things come from outside to us. This is not a fort where we put a wall and then nobody else is coming. This is a very transparent world. People come and go. So once we are satisfied, if we immunize everybody, the chances of this kind of variant developing gets lesser because the herd immunity goes along, and then maybe one day the world is immunized fully, and then this virus will never get to us, and maybe like a flu,
Final few questions here. You mentioned, and to your point, the numbers are quite low in Florida. The infection rate is below 5%, which is what health leaders like to see. And I think, as you mentioned, physicians, nurses, people who've been through this for the last year and a half, 2 years now, everybody's been kind of breathing a sigh of relief and enjoying these last 2-3 weeks, maybe 4 or 5 weeks. But moving into this next phase, not knowing, as you mentioned, it'll be 2 or 3 weeks before we know. Do you recommend an average healthy person, even someone who's been vaccinated, even gotten a booster, do you recommend a social distancing, optional masking? Is that your recommendation to your patients?
Yes, even including the WHO guidelines all the way along now, since we don't know, the unknowns are still there. Yeah, you can protect yourself wearing a mask, and avoid unnecessary, contact, and then sanitize your hand. And now I think the problem with that is, we just got into the lull of social, interaction is getting much more closer. And unlike the, first time around, second time around, now it's very hard for people to break that habit. But I think we can, when I started, people started shaking hands and stuff. I was laughing. I said, it's been a long time since we did that. Now we are back to that.
Mhm.
But we can, till we know what this variant is going to do for sure. That will be a couple of weeks. At least till then, you know what? Just be cautious. Once we know this is just a mild variant, hopefully praying that's what it is and that's what it's going to be. Till then, yes, follow, please wear a mask, safe and social, follow social distancing guidelines till everything, and please get immunized and get boosters. So these are the things which at least we can do, but at least for the next couple of weeks.
Dr. Gopalan, Ramprasad, we certainly appreciate your time taking time away from your patients in the hospital right now and your busy practice as well in West Palm Beach. We appreciate your perspective as an infectious disease specialist who has taken care of this community for the entirety of the pandemic, and we appreciate your service and your caring of your patients and your love on our community. Thank you so much for your time.
Thank you. Thank you. Please
Appreciate
get
it.
immunized.
And we appreciate you at home tuning in this afternoon on this special StreamYard edition as we unpack the news that the first reported case of the Omicron variant has presented in California. We'll have much more coming up on News Channel 5 at 4 o'clock. Until then, good afternoon.
Thank you.